Have you ever wondered why doctors pull down your lower eyelid or stare closely beneath your eyes during checkups? It looks like such a simple action, but it can reveal more about your health than you might think. What are they actually looking for? Is it just a routine they learned in medical school, or are there real, vital clues hidden there? Today, I'm going to show you the surprising medical secrets hidden right under your eyes, turning this seemingly small gesture into a fascinating window into your well-being. By the end of this video, you'll understand why this quick check is one of the most powerful diagnostic tools a doctor has. First, let's talk about the most common reason, the eyelid blood test. When a doctor gently pulls down your lower eyelid, they are checking the color of the inner tissue, known as the palpebral conjunctiva. This isn't just a random observation. It's one of the fastest, non-invasive ways to screen for anemia. Anemia is a condition where your body doesn't have enough healthy red blood cells to carry adequate oxygen to your body's tissues. In a healthy person, this inner eyelid tissue should be a vibrant, bright pink or reddish color. This indicates good blood flow and a healthy level of hemoglobin, the protein in red blood cells that carries oxygen. However, if it looks pale, whitish, or very light pink, it's a classic red flag for anemia. This paleness suggests a low hemoglobin count, which is often caused by iron deficiency. Without even needing a blood test, a doctor can get a strong indication that you might be experiencing symptoms like chronic fatigue, weakness, shortness of breath, or poor oxygen circulation. It's an incredibly efficient initial screening tool. If your doctor notices this, they'll likely order a complete blood count to confirm the diagnosis and investigate the underlying cause. It's amazing how a simple color check can kickstart such an important investigation into your energy levels and overall health. Next, doctors examine the whites of your eyes, also known as the sclera. Ideally, this area should be clear and white. If your doctor notices a yellowish tint, it's an immediate signal for a condition called jaundice. Jaundice itself isn't a disease, but rather a visible sign of an underlying health problem, usually related to the liver, gallbladder, or pancreas. The yellow color is caused by a buildup of a substance called bilirubin in the blood. Bilirubin is a yellow pigment that's formed when old red blood cells are broken down. Normally, the liver processes bilirubin and removes it from the body. When the liver isn't working correctly, bilirubin can accumulate, causing the skin and eyes to turn yellow. This could point to a range of issues, from relatively manageable ones like Gilbert's syndrome to more serious conditions like hepatitis, cirrhosis, blocked bile ducts, or even problems with the pancreas. A quick look at the whites of your eyes can alert a doctor to potential organ dysfunction long before you might feel any pain or other distinct symptoms. So, that yellow tint is a crucial warning sign that prompts further investigation into some of the most important organs in your body. Another important clue doctors look for is signs of dehydration. Have you ever looked in the mirror and noticed your eyes seem a bit sunken? Or maybe you have more pronounced dark circles than usual. While often blamed on lack of sleep, these can also be key indicators that your body isn't getting enough water. When you're dehydrated, the delicate skin under your eyes, which is already very thin, can lose its elasticity and volume, making the eyes appear sunken. The blood vessels under this thin skin can also become more prominent, contributing to the appearance of dark circles. A doctor can spot this almost instantly. They might also notice if the eyes themselves appear less moist or if the eyelids look dry and crepey. Dehydration is a common issue that can cause a wide array of symptoms, including dizziness, frequent headaches, confusion, and persistent tiredness. By noticing these subtle changes around your eyes, a doctor can quickly connect the dots and recommend increasing your fluid intake, which can often resolve these other nagging problems. It's a simple but effective way to assess your body's hydration status at a glance. Your eyes are also a hotspot for revealing allergies and infections. Puffy eyes, redness, excessive watering, or a gritty feeling are all things a doctor will take note of when examining the area beneath your eyes. For instance, puffiness, especially in the morning, can be a telltale sign of allergies. When you're exposed to an allergen, your body releases histamines, which can cause blood vessels to leak fluid into the surrounding tissues, leading to that swollen, puffy look. If the puffiness is concentrated under the eyes, it might even suggest sinus congestion or blockage, as poor drainage can cause fluid to accumulate there. Redness in the conjunctiva or along the waterline is another major clue. It can point to simple irritation from dust or dry air, but it could also signal an infection like conjunctivitis, also known as pink eye. Excessive watering could be your body's attempt to flush out an irritant, or it could be a symptom of a blocked tear duct. By observing these signs, a doctor can quickly differentiate between a systemic allergic reaction, a localized infection, or a structural issue. Your eyes are often the first place these conditions manifest, making them an excellent diagnostic starting point. Believe it or not, the area beneath your eyes holds clues to your body's overall systemic health, extending far beyond the eyes themselves. Doctors are trained to spot subtle signs that could be linked to a wide range of conditions. For example, certain types of swelling or puffiness around the eyes that don't go away can sometimes be associated with kidney problems, as failing kidneys may struggle to remove excess fluid from the body. Another example is thyroid eye disease, a condition linked to an overactive thyroid, which can cause the eyes to appear wide, staring, or even bulge, along with swelling of the eyelids. Small, yellowish bumps of cholesterol deposits on or around the eyelids, a condition called xanthelasma, can be an indicator of high cholesterol levels, which is a risk factor for heart problems. Even chronic stress and lack of sleep manifest clearly in this area, causing dark circles and a tired appearance that a doctor will recognize as a sign of physical or mental exhaustion. It's like a hidden map of your well-being. That's why even a small, persistent change in the appearance of the area around your eyes should never be ignored and is always worth mentioning to your doctor. So, the next time you visit a doctor and they look closely beneath your eyes, you'll know exactly what's happening. They aren't just checking your appearance or performing an empty ritual. They are reading your body's hidden health signals, gathering vital information about your blood, your organs, your hydration levels, and your overall health in a matter of seconds. It's a testament to the incredible efficiency and power of a thorough physical examination. If you found this video helpful and learned something new, make sure to hit that like button, share it with someone who might be curious, and subscribe for more eye-opening health facts. Thanks for watching. Stay curious and see you in the next video.